Well, I think programs like these and the programs that the judge talked about, I'm glad that we hopefully can get these programs out, that we can address chronic mental illness. It's a severe problem. We saw how long it took to address the opiate crisis and all of the resources that went forward. If we've had a much longer crisis in mental illness that we haven't brought these resources to. And through this awareness and through newer medications and great programs like we've heard about, hopefully we're moving in the right direction.
Judge,
I don't know how pithy that was.
That was pretty pithy. Judge?
We have a mental health crisis in this country. And the way that we've been treating people with serious mental illnesses in many ways is criminal. And we've been using a criminal justice system model where we need a population health model. And we need to start treating this as an illness, not a crime. And we know through programs like Chicago and what we've done in Miami through our jail diversion program that if we divert people before and after they penetrate the criminal justice system, we can get amazing results and amazing outcomes. We do not have to settle for the status quo. These illnesses are treatable. People can recover and they can lead much healthier lives. And it is inexcusable that we're using a criminal justice system to try to get people treated.
Dr. Jones Tapia.
We're talking about human lives here. And when we're talking about people, we're talking not just about that person that we're incarcerating unjustly, but their family. There are hidden victims to this mass incarceration, and especially the mass incarceration of those with mental illness. And so we really need to take a more thoughtful look at those costs to society, and including the cost to the family as well as the individual. And we need to break the silos. We've been talking about that throughout this discussion, but until we get to that point where the correctional institution is seen as a part of the community and they work hand in hand with the community, we'll continue to contend with this issue.
Guess who's got the last word, Dr. Tohen?
Well, as we started the discussion today, the issue of mental illness matters to all of us. It affects society, it affects patients and their families. And the only way to solve it is by having collaborative work. We've mentioned it many times. It's just not the medical services, the mental health services, it's also law enforcement, and also very important, education. And it's not only education of the providers, it's also education of the officers and also education of the community. We sometimes forget about stigma. The mentally ill not only suffer from their condition, but also the stigmas of society. And only if we work together with the courts, with the I guess, jail and prison services and the medical services, that's the only way we're going to be able to help our patients.
Well, what a tremendous discussion. An area, I must confess, that I hadn't thought about all that much. And I don't think I'm unusual. I think a lot of clinicians have not, but it's time they did. Obviously, I'm grateful that some people have been thinking about this. Now we got to implement all of this. I want to thank all of you for your contributions to this discussion. On behalf of our panel, I want to thank you for joining us. I hope you found this MD Magazine peer exchange discussion to be useful and informative. I'm Dr. Peter Salgo, and I'll see you next time.